the St. Louis County Department of Health for 9 years. He was a trusted employee. He was hardworking, smart. He proved he could handle responsibilities, giving and deliver results over the 9 years. He originally came to us in the Information Technology Division, had worked his way up through the ranks, had taken on any and all of the leadership programs we have for our employees, and performed very, very well. And as a result of that, was promoted within the departments as he worked for us. That being said, we are saddened by his death, but most importantly, we are saddened by what appears to be a blatant abuse of that trust and abuse of his authority in St. Louis County. Ed Mueth had worked daily with my staff and myself, and nothing would have led anyone to believe he was involved in anything of this magnitude prior to the events. As I mentioned before, I wanted to thank my staff for doing an outstanding job. I really want to thank specifically the fiscal team here at St. Louis County Department of Health. I've always stressed accountability, especially when it comes to our fiscal items, and we begin to have questions during our budget review between 2013 and 2014 budget sessions. We like to occasionally, on an annual basis and periodically, just look at some checks and balances within our system. And the question had come up during that process on one or two specific line items that we did not feel comfortable with. I encouraged my staff to continue to look and to ask questions, and they did so appropriately. And they did their job, and I'm very proud of them for doing it. As I had stated earlier, what triggered this was a concern of a specific service agreement or cost line item that we had in our budget that was related specifically to health information technology and computer laptops. We looked at the lease arrangement that had actually went out to bid that was awarded to Gateway Technical Solutions, who had subsequently won that bid contract. The contract in question for us is the period between 2008 and present. The contracts were for 3-year periods between 2008 and 2011, and 2011 to 2014 with the end date in February of 2014. And we are we're in the last phase of the second year of that contract when this occurred. As far as the bid process is concerned, is the contract went out for competitive bid, like many of our contracts do under procurement. And Gateway had won a competitive bid in 2008 with some of its competitors being Worldwide Technologies. After they won the lowest apparent bid, it went back out for bid again in 2011, and they were again the lowest responsible bidder that had responded. So we asked ourselves, what happened here? What apparently happened in question was one specific contract for goods and services that had came up to bid, and understand that this particular contract, the funding for this contract was out of what we call general health funds or 103 funds. There's no federal dollars that were involved here at all. But it does appear that Mr. Ed Mueth has set up a company, registered it with the state of Missouri under Secretary of State, also created some fictitious name to register this company in the state of Missouri, and took advantage of this insider information to craft a bid relative to the contract opportunity that occurred. Did we receive goods and products? Yes, we did. And we began to pay invoices based on that current contract, or based on that contract from 2008 forward. So here's some things I'd like to clarify, and additional information regarding what appears to be a very well-planned and executed scheme involving payments on contract for goods and services of St. Louis County Department of Health. And again, please understand that this is a preliminary investigation, and the investigation is continuing.